What is the leading cause of preventable death in the United States? According to lung.org, tobacco use and secondhand smoke is the leading cause of preventable death in America. We all know at least one person that smokes. What if by listening to this speech, you could prevent that person from dying while bettering your own health? I am a respiratory care practitioner. I have practiced respiratory care and life-saving measures for 3 years in a freestanding ER. This speech is intended to persuade smokers to stop smoking, not just to better their own health, but to better the health of the people that they love. In order to persuade smokers to stop smoking, we will discuss impending health risk, the risk and dangers of secondhand smoke, and the cost of tobacco products. We've all heard how dangerous smoking is and how it can kill those around us. But what do we really know about it? How does it affect our bodies? Smoking cigarettes affects the entire body. There is not one major organ that it does not affect. And according to Egan's Fundamentals of Respiratory Care, lung cancer is the leading cause of cancer deaths in the United States. That surpasses colon cancer and even breast cancer. 90% of patients that are diagnosed with lung cancer are active smokers at the time of diagnosis. That's 90% of preventable deaths due to tobacco. Smoking even affects your appearance. Smoking affects blood vessels that carry oxygen to the skin. When these blood vessels are damaged, oxygen delivery is inadequate, causing wrinkles, loose skin, and uneven skin tones. This information can be found at onhealth.com. It's hard to quit, and I fully understand that. Often I hear people say, well, I've smoked for X amount of years, why should I quit now? Well, if you could possibly help and save the people around you, why wouldn't you stop then? Secondhand smoke is a real thing that affects thousands of people yearly. People exposed to secondhand smoke increase their risk of lung cancer by 30%. There are 5,000 deaths yearly in America due to secondhand smoke. According to the CDC, children exposed are more likely to have asthma, ear infections, respiratory diseases, and even pneumonias. Just think, that is something that we are doing to our children. When women that are pregnant increase their risk of low birth weight babies, premature babies, and even babies that will require ventilatory support at birth. So far we understand the health risks surrounding smoking. So now let's talk about the money you may save if you decide to quit. Smoking is an addictive habit, but it's also a costly habit. But how much money are you spending on cigarettes, and how much could you be saving? VapingDaily.com states that in 10 years, a smoker will spend $50,000 on cigarettes. That's $50,000 a person is spending on a substance that is killing them. Not only will you save money by not purchasing these products, but think about how much you will save from medical bills, medical debt, prescriptions that you now have because you are a smoker. Think about all of that money that could be saved. There are many financial benefits to smoking cessation. Money is important, and if you could save some by quitting a nasty habit, why wouldn't you? In conclusion, there are so many different dangers to face when discussing cigarettes and smoking. Our health and the health of the people we love is irreplaceable and should be highly considered when discussing the negative impacts of cigarette usage. The cost is something else that should be discussed. When considering not just the cost of the product, but the cost of health insurance and medical debt that can even occur. Smoking easily kills thousands of people every single day. I propose that we all realize the dangers and terrible outcomes that smokers and non-smokers face due to cigarettes. Smokers, quit today. Understand what you are doing to your body and understand what you are doing to the people you love around you. Non-smokers, educate and be a part of the encouragement that smokers need to quit. Smoking is a terrible, terrible habit that we can all prevent whether you are a smoker or a non-smoker. And I hope this speech has encouraged you today to talk to the people you love and persuade them to quit smoking. Thank you so much. Are there any questions? No?